Immediately after his inauguration, President Trump signed a flurry of executive orders signaling his return to the White House. The executive orders declared a national energy emergency, pardoned individuals involved in the January 6th riots, paused the TikTok ban, froze hiring by federal government, renamed Mount Denali and the Gulf of Mexico to Mount McKinley and the Gulf of America, and numerous other undertakings of a variety of policy initiatives. But one order which fell largely under the radar was an executive order starting the one-year process of withdrawing the United States from the World Health Organization, often referred to by its acronym WHO. But what exactly is the World Health Organization? Why does President Trump want to withdraw from it? And how will the U.S. withdrawal affect global politics? Hey everyone, I'm Noah Zerbe. I'm a professor of global politics at California State Polytechnic University Humboldt. Welcome to Global Insights, where we explore contemporary events in international relations. Let's start with the basics. What is the World Health Organization and what does it do? The World Health Organization, or WHO, was established in 1948 as the United Nations Specialized Agency for Global Health. Its self-declared mission is ambitious: to promote global health, keep the world safe, and serve the vulnerable. Over its history, the World Health Organization has achieved some remarkable successes. It spearheaded the eradication of smallpox, a disease that once killed millions of people every year, and it also led the near-eradication efforts of polio and has been instrumental in managing global public health emergencies like Ebola outbreaks and the COVID-19 pandemic. Programs like those targeting HIV/AIDS, maternal and child health, and vaccine distribution have saved countless lives worldwide. While the WHO has achieved some significant successes, it's also faced criticism that fuel debates about its future. Like many international organizations, the WHO has been criticized for being overly bureaucratic and too slow to act. More specifically, the organization has faced criticism for its perceived deference to China during the early days of the COVID-19 pandemic, and its reliance on voluntary funding, which gives major donors significant influence over its priorities. These critiques underscore both the organization's achievements and its vulnerabilities. And it's precisely these shortcomings that the Trump administration cites in the executive order citing the reasons for U.S. withdrawal. In that order, President Trump asserts that the United States is withdrawing due to the organization's mishandling of the COVID-19 pandemic that arose out of Wuhan, China, and other global health crises, its failure to adapt urgently needed reforms, and its inability to demonstrate independence from the inappropriate political influence of WHO member states. In addition, the WHO continues to demand unfairly onerous payments from the United States, far out of proportion with other countries' assessed payments. The withdrawal of the United States from the World Health Organization will take about a year to complete, but the organization is already facing some immediate challenges. First is funding. The WHO relies on assessed contributions from member states for about 20% of its total budget. Those assessed contributions are based on the size of the national economies, essentially each country's gross domestic product. Under its funding formula, the United States contributes 22% of the assessed contributions, with China being the second largest funder at about 15%. Collectively, just 12 countries provide about 3/4 of the total assessed contributions of the WHO. These contributions support the core operations of the World Health Organization, but the vast majority of funding, about 80% of the total budget of the organization, comes from voluntary contributions, which come from both member states and from private donations. While providing a majority of the organization's funding, such voluntary contributions are often earmarked for specific projects, allowing major donors to shape the WHO's priorities. The withdrawal of the United States leaves the World Health Organization with a pretty big hole in its budget. Most observers expect that Asia and the Middle East will increase their contributions to the organization, but it's unlikely that increased support from other regions will be able to fully offset the loss of U.S. support to the organization. Further, the U.S. withdrawal will have an impact beyond just funding. The executive order calls for the immediate recall of American staff seconded to the World Health Organization from various U.S. agencies. In global politics, secondment is a temporary work assignment where an employee of a national government is temporarily assigned to work for an international organization. The WHO relies on seconded staff from its member states to fill a variety of technical and medical roles. Indeed, the United States had about 30 employees of the Centers for Disease Control seconded to the World Health Organization in Geneva in January 2025. These seconded staff were working in collaborative research, disease surveillance, and global health initiatives. Their withdrawal will likely impact ongoing research and collaboration between the United States and the World Health Organization, and the loss of technical expertise provided by seconded staff will negatively impact those WHO programs. The withdrawal of the U.S. from the World Health Organization is not just about funding or personnel. It's emblematic of a broader trend, the decline of multilateralism in global politics. Multilateralism at its core is about collective problem solving. The World Health Organization exemplifies this principle, enabling nations to pool resources, share expertise, and coordinate responses to global health emergencies. Pandemics, after all, do not respect national boundaries. But when powerful nations like the United States withdraw from such organizations, the spirit and mechanism of multilateralism is weakened. Without the WHO's coordinating role, we risk fragmented, nationalistic responses to pandemics, leaving dangerous gaps in global health security. Yet, this retreat by the United States creates an opportunity for middle powers, countries like Canada, India, Pakistan, Saudi Arabia, South Africa, South Korea, and many, many others, to step up. Such countries have a history of leveraging their diplomatic expertise, policy innovation, and coalition-building skills to sustain multilateral efforts. Again, there are many examples here. During the COVID-19 pandemic, Germany was often a leading voice advocating for stronger pandemic preparedness and equitable vaccine distribution, including supporting the COVAX initiative, which sought to ensure vaccine delivery in the global south. Similarly, South Korea drew on its experience addressing outbreaks like MERS to promote public health systems modeled on its own system emphasizing rapid testing and digital contact tracing. The Nordic countries regularly play a central role in promoting multilateralism, often working to mediate between larger powers in multilateral organizations. They have a history of generous support for global development and public health initiatives. India stepped up to become one of the world's leading vaccine manufacturers, producing a significant percentage of the world's vaccines and supplying more than 90 countries with vaccines under its Vaccine Matri, the Vaccine Friendship Program, which emphasizes equitable access to vaccines. And during its leadership of the G20, Saudi Arabia made global public health its priority, coordinating international efforts to combat COVID-19 and promoting funding for vaccine distribution and pandemic response, including donating more than $500 million to support global pandemic preparedness, vaccine distribution, and research. We could go on, but collectively these efforts highlight the ability of middle powers to fill leadership gaps, not just through financial support, but by crafting policies and uniting diverse actors around common goals. On a broader level, middle powers often play an important stabilizing role in multilateral politics. But as the United States steps back and China increases its influence in the World Health Organization, middle powers are likely to find themselves navigating a complex geopolitical landscape. By collaborating with one another and with other stakeholders, they can help ensure that multilateral organizations remain independent and effective. The U.S. withdrawal from the World Health Organization not only disrupts global public health efforts, but also challenges the foundational principles of technical cooperation in global politics. This decision reflects a shift away from functionalist ideas that have long been supportive of international institutions like the WHO and raises questions about the future of global public goods. Functionalist theories in international relations argue that cooperation in specialized areas like health, transportation, or communication can build trust among states. The idea is that by addressing technical challenges requiring collective action, efforts can lead to broader cooperation. Organizations like the World Health Organization embody this principle, bringing together countries with vastly different political systems to tackle shared problems. For decades, the WHO's successes, like eradicating smallpox, have demonstrated how public goods can emerge from this collaboration. These accomplishments build on trust and reinforce the notion that multilateral institutions can rise above geopolitical rivalries. However, the U.S. withdrawal undermines this trust in several critical ways. By framing the WHO as overly politicized and influenced by specific member states, the decision signals skepticism towards the very idea that technical organizations can cooperate independently of power politics. This erodes confidence in shared institutions and discourages other countries from investing in global public goods. Why contribute to an organization if its impartiality is seen as compromised? Neo-functionalist theories take functionalism a step further by arguing that technical cooperation in areas can create spillover effects into other domains. For example, cooperation in addressing public health challenges might lead to further cooperation in areas like trade, security, or on environmental issues. This theory underpins much of the post-World War II multilateral system, from the World Health Organization to the International Telecommunications Union. The U.S. decision to withdraw challenges this logic. Rather than strengthening cooperation, it prioritizes unilateral action, undermining the idea that technical organizations can serve as neutral platforms for global integration. This retreat could encourage fragmentation, where countries disengage from shared institutions, opting instead for ad hoc or bilateral arrangements. As a result, health outcomes and broader global governance become subject to geopolitical rivalries functionalist frameworks sought to transcend. This impact extends far beyond health. The WHO is a prime example of a global public good, an institution that addresses collective needs benefiting everyone regardless of their individual contributions. By withdrawing, the United States reduces resources available for addressing global health challenges, forcing other countries to shoulder a heavier burden. This risks creating a vicious cycle where reduced funding leads to weaker performance undermines public confidence in the institution, and as trust erodes, countries become less willing to contribute, further destabilizing the system. In this context, the U.S. withdrawal does more than just reduce immediate funding or personnel. It signals a fundamental shift in how states view technical cooperation, raising questions about whether multilateral institutions can continue to deliver global public goods in a more fragmented world. As the United States steps back from the World Health Organization, it creates a leadership vacuum that China seems poised to fill. China's already signaled its intention to increase support for the WHO. Shortly after the United States announced its withdrawal, the Chinese Foreign Ministry issued a statement saying the WHO's role should only be strengthened, not weakened. This statement reflects a broader effort by Beijing to position itself as a champion of multilateralism, particularly in contrast to Washington's retreat. As we've already considered, the United States has historically been the largest financial contributor to the WHO, and the U.S. withdrawal leaves the WHO with a substantial funding shortfall. But China, as the world's second largest economy, has the capacity to step in and fill this void. By increasing its contributions, China will likely gain greater leverage over the organization's priorities, ensuring they more closely align with its strategic interests. China's active support for the WHO is also part of a broader soft power strategy. By stepping into this role, China can position itself as a reliable and cooperative global leader, particularly in the eyes of the global South. Many low and middle income countries, which have long relied on WHO programs, are likely to welcome Beijing's increased engagement. China's expanding financial contributions and active engagement would also give it greater sway in WHO decision-making bodies like the World Health Assembly and the Executive Board, allowing Beijing to shape global health priorities and norms in ways that align with its geopolitical objectives. Finally, China's growing influence within the WHO also reflects a broader challenge to Western dominance in global governance. With the United States stepping back, middle powers like Germany and France may find themselves aligning closely with China on key health initiatives to sustain the organization's effectiveness. This coalition building bolsters China's position as a leader in multilateral institutions while highlighting Washington's absence and diminishing influence. The U.S. departure from the WHO is more than just a health policy decision. It's a signal of the shifting priorities in global governance. As other powers step in to fill the void, the future of multilateralism and global health cooperation hang in the balance. But what do you think? Should the United States reinvest in multilateralism, or is this retreat a necessary recalibration of its role in global politics? Leave your thoughts in the comments section below. That's it for today. If you found this helpful, give the video a thumbs up and subscribe to catch the future episodes as they're released. Thanks for watching, everyone, and I'll see you next time.